the first presentation today, we have Darrie Ichilov. He's a licensed physical therapist with over 30 years of dedicated experience in the field of physical therapy. Darrie has established a reputation for providing compassionate, patient-centered care that helps individuals restore function, manage pain, and improve quality of life. That sounds amazing. As a result of his years of experience, Darrie recently invented a lower back pain relief device called the Bax-si. So please help me welcome Darrie Ichilov.
Thank you, thank you, thank you. All right, so without further ado, oh, okay. So allow me. Check. Is it working?
Yeah, keep talking.
Check.
Sometimes it takes a while.
1, 2, 3.
Can I give you a
Yeah. Here. So then no, that's fine. Did it come on?
Yes. Yeah.
Hello? Check. 1, 2. Oh, raise the volume.
Nope. He's got it.
Check. Better? Okay, good. So now,
We'll do the loud thing.
you want this one?
Yeah, that one.
There we go. Okay. So first of all, thank you very much for having me. I want to thank you. So let me start off. The topic we're going to be covering today, and I'm sure it hits home for a lot of people here, is lower back pain. Perfect. So as we take a look at the slides, lower back pain is the leading cause of disability in the world. 1 in 13 people, which in 2020, a research study was done, and it was discovered that 619 million people in the world suffer from back pain. In 2023, Sydney, Australia University did a projected study of lower back pain. And what ended up happening was they discovered that 850 million people are expected to be lower back pain sufferers by 2050. That's almost a 30% increase. The World Health Organization, they have been actively trying to fix this problem. The main reason is anyone who's suffered from lower back pain knows what the typical treatment for lower back pain is. Opiates, narcotics, injections. All these treatments are treating the symptoms and not the underlying cause of lower back pain. So typically, when you look around and you hear of a fentanyl overdose problem or an opiate problem, somebody who's suffering from chronic lower back pain takes pain medication, feels good, goes and does everything that gave him the lower back pain. And then the pain medication comes down. They're in pain. So what do you start doing? You pop more and more and more. And before you turn around, you're addicted because it's the only thing that takes the edge off of the lower back pain. So the World Health Organization, by 2030, is putting together a rehabilitation approach. They came out in 2023 with new guidelines for lower back pain. Most of you don't even realize that they exist, which is interesting because for lower back pain, what do you think the #1 at-home treatment for lower back pain is? Anyone venture a guess?
Is this old or new?
Oh, traditional. Rest is one. But outside, forget rest. Rest doesn't require purchasing anything or doing anything. No, that's on the medical side. I'm saying if you get back pain, go to Walmart, go to a pharmacy. What was that?
A brace or a patch?
A brace. You go to Amazon, Shopify, any one of these companies and put lower back pain, I guarantee you the first things that pop up are back braces, back belts. And in 2023, if you take a look, it's one of the things that the WHO does not recommend. The reason being is that the back belt is a crutch. What you do by putting on the back belt is you are taking your muscles that should be working and telling them, we don't need you. So you put the belt on and you start wearing and you feel better. That's good. But your muscles start to undergo what's called atrophy. They weaken. So now what happens is every time you take the belt off, your muscles don't have the ability at all to support you. That's one of the reasons why the WHO has gone on a whole different program related to lower back pain. Education, exercise programs, physical therapy, but not all physical therapy. And the reason I say that is things that cause your muscles to either atrophy or to tighten up. We'll get into that afterwards when I talk about the anatomy and the lower back itself. But things like traction, which are done in chiropractic clinics and in physical therapy clinics. Over-the-counter medications versus prescription. Pushing your arthritis. Tylenol, which works for pain. But Advil, ibuprofen, which works for, inflammation. For the longest time, we were told you couldn't take both of those together. Advil came out, I believe, last year, not that I'm promoting it, but there's something called dual action that actually has acetaminophen and ibuprofen in the same medication together. So what's happening is everything right now is in a state of flux, of change. We're trying to figure out exactly what's going to work, what isn't working. If you take a look, excuse me for just a second. Perfect. Actually, I think I skipped. No, that was one. Okay. So let's get to the nuts and bolts of what exactly is going on. So with lower back pain, actually, let me see something for a second. I apologize. Okay. So when you talk about lower back pain, the layman has pain somewhere in this area. And you go to the doctor and you say, Doc, I've got lower back pain. The layman doesn't understand the anatomy of the back. And a lot of times what ends up happening is when you go to the doctor and you say you have lower back pain, it's not necessarily the lower back itself. And allow me to show you. If you look right here, right there is the bottom of the spine. That's L5, that's L4, that's L3. So right here, right underneath, you'll see this part of bone that looks like it's a number of bones fused together. It almost looks like a spearhead at the bottom of the spine pointing downwards, or an arrowhead. That is the sacrum. Right next to it are these two ilia, or the iliac crest. Basically, African elephant ears. Best way to think of it. Where the African elephant ear meets the spearhead is the sacroiliac. Right there. It is a joint, but not in the true sense of a joint that we're used to. When you think of a joint, you think of the shoulder. You think of the elbow. You think of the wrist, the hip, the knee. And they articulate a lot of motion. The sacroiliac only moves 2 to 4 millimeters. Very, very small. And it only has basically... Sorry. So the only way that the sacroiliac moves is forward and in, or backwards and out. That's it. Forward and in, known as nutation, means that it's in a locked position. Backwards and out means it's in an open position, counternutation. Now, why is that so important? If you look at the way the body's put together, the largest muscles in the body are where? The legs, exactly. Let me digress for a second. The human body is made up of a lot of systems. For example, the cardiac, the respiratory. And a lot of these systems work together in order to achieve what they want. The reason I bring the cardiac and the vascular is 2 completely separate systems. But they have to work together in order for respiration to take place. The heart pumps the blood around, cells get oxygen, they release their carbon dioxide, it goes back into the lungs, and it gets released. If the lungs stop working, system breaks down. If the heart stops working, system breaks down. Same thing with the sacroiliac. What the sacroiliac does is, think of it as a bridge, a coupler, between the legs and the spine. The spine wants to stabilize. The muscles around the spine want to stabilize and protect the spine. That's what they do. And maintain your eyes parallel to the horizon. Why is that important? It's because it's about survival. If your eyes remain parallel to the horizon, you can track, you can hunt, you can do everything you need to do. It's one of the reasons why whenever you have pain, discomfort, injure yourself, your body goes through these contortions. And the reason is because ultimately your eyes want to remain parallel to the horizon. Because the sacroiliac only has 2 to 4 millimeters of motion, there's not a lot of protection, cartilage protecting it. Think of your knee joint. Think of your hip joint. A lot of cartilage, a lot of wear and tear, but a lot of cartilage. Because it doesn't have a lot of cartilage, the degeneration and the abuse that the sacroiliac takes is tremendous. You wear through it relatively quickly, and you start degenerating the sacroiliac. And what'll happen is all of a sudden one day you'll get out of a car, step off a curb wrong, bend down to pick up a case of water, and all of a sudden you'll feel that click. You know instantly you've done something wrong, and within the next 30 minutes, you start to realize, uh-oh. Now, basically what happened is your sacroiliac locked up. You go to a chiropractor. They try pushing it. You go to a physical therapist. They do stretches, all these different things. Nothing really opens up the sacroiliac. Now, why is that such a big issue? Remember we said the largest muscles in the body are in the legs? Their primary purpose are to get us from point A to point B, motion or locomotion. Remember, the spine wants to stabilize and protect. Every so often, when, for example, you're in a gale force wind, or you're standing to attention, you have the ability by locking up your sacroiliac to recruit your legs to become stabilizers. So at that point, they're stabilizing. They help the back muscles strengthen. Think of a tree trunk. You can't push that thing over. Same thing with us. When it's locked. When it's open, two independent systems. The legs work on motion. The back works on stabilization. Now, imagine your sacroiliac is locked up. What ends up happening is you have two separate systems working against each other. Why do I say that? Well, think about this. If your muscles, and I'm going to get a little mathematical, but it'll be easier to understand. If your muscles generate 100 pounds of force, when the sacroiliac is open, 100 pounds of force goes to what? Motion. When the sacroiliac is locked up, a percentage bleeds up into the spine. We don't know the exact percentage, but because it's open, so what happens is you lose the ability to perform at 100% using your legs to get from point A to point B because you've got a conflict going in the spine. When you have a conflict in the spine, you create a tug of war. Your back muscles want to stabilize. Your leg muscles want to move. Who do you think's going to override one over the other? The spine. Because it's about survival. So your spinal muscles contract even more and become tighter. So that it creates pressure. It squeezes. The nerves, if you take a look, come out at each level through these little holes. They become compromised. Pressure gets put on them. You develop things like sciatica. Because the nerves involved in the sciatic nerve, L3, 4, and 5, now are being compromised. Now what happens is the signal is being sent down the leg. What they have learned is that 25% of lower back pain is related, to the sacroiliac. I believe the number is higher. Now, why do I say that? In medicine today, the sacroiliac itself, the joint, is believed to be a hammock, a sling that supports the upper body on the legs. I just believe that there's a lot of discoveries still to be made in science, and my hypothesis is that what goes down with the body also comes up. And I think we've missed the boat on the opposite direction from the sacroiliac. Now, why is this so important? 25 years ago, I came up with a technique for treating lower back pain. I had patients lie on my hand, and I worked my fingers into the sacroiliac. Literally let the body just lay on it, work my fingers in, and then pry it open like a crowbar. The results are instant, literally incredible. So over the years, I've treated thousands of people and have gotten tremendous results. Tried to teach the technique. Anyone seen free rock climbing? How many of you have volunteered to go do it? Exactly. The reason is when you have individuals between 150 to 400 pounds on your fingertips, it's going to be painful, as I discovered when I tried to teach. I'm not going to say impossible. I'm sure there are people out there. Oh. So come COVID, let's fast forward to COVID. I'm not getting any younger yet. But I figured this technique works amazingly well. And my fear is that it disappears once I stop practicing or I stop treating. So I met with an engineer, and we sat down and started thinking through the process 2 years ago. And we came up with a device, excuse me. I think the slides are out of order, Rama. Sorry. Okay, we came with the Bax-si. It's basically an abstract version. I don't have that many hands. Sorry, can you hold it just? So if you take a look at the Bax-si, it basically is an abstract version of my hand. And what it does is, thank you, through 4 positions, it allows you to be able to work the head of the Bax-si in, and then allow, by rolling your leg out, for it to actually pull the sacroiliac open. All right? Until the Bax-si was invented a year ago, there is no other device on the market that opens up the sacroiliac. There's a lot of devices that apply pressure. Anyone here who's used a tennis ball on their shoulder blade? Anyone here who's used a foam roller for the ITB? That's all based on pressure. And the thing is, I'm going to go backwards. With the sacroiliac, most of us, when we look at pictures of the body, it's in 2 dimensions. So everything looks flush. When you see x-rays, you have to have an understanding anatomically, 3-dimensionally, of how things look. See how everything looks like it's almost neatly put together? It's not quite the story. What ends up happening is the ilia, the elephant ears, actually sit over a little bit the sacrum, which allows a space for you to be able to work your fingers in. That's what the Bax-si does. There we go. Okay. Pain. How do you know your SI is locked up? Well, you really don't unless somebody evaluates you. But these are some of the common symptoms when the sacroiliac is locked up. In the lower back, you tend to have one-sided pain. Right, left, doesn't make a difference. Typically, it's on the opposite side of where the problem's happening. You'll feel weight on your, for example, I'm going to give you an example on me. If you take a look, the way I'm standing, do you notice what's happening? Which leg am I putting more weight on? So I'm going to have more pain on the right. For example, I weigh 200 pounds. Each leg should carry how much? 110. Excellent. 100 pounds. But because I'm leaning this way, this leg is carrying now 130 pounds, and this leg's carrying 70 pounds. What's going to happen to the right side? It's working harder. It's going to be more sore. You're going through the limb quicker, through the joints. And therein lies the problem, a lot of times. Anyone who's had lower back pain and gone to the doctor and say, my pain's on my right, you'll go, and a lot of times what'll happen is they'll do an x-ray, and it'll show some arthritic degeneration. They'll send you to an MRI. It'll show some minimal disc bulge, but it doesn't explain why you're having the symptoms. So then they prescribe pain medication, or they send you to a pain clinic because they want to prescribe you pain medication, because internists no longer are allowed to prescribe pain medication based on insurance companies' regulations. So, based on my understanding and knowledge, what I have learned is that the opposite side is causing the problem because of compensation. Okay. Typically, when you have a locked sacroiliac, you're not going to walk as much. You're not going to move as much. You're going to be sitting more. Sitting, and anyone who has a sitting job is asking for trouble. Asking for trouble. Muscle has what's known as muscle memory. What does that mean? Muscle memory means basically that a muscle will adapt to be at the optimal length that you ask of it based on what you do on a daily basis. So if you're sitting, look at the distance, for example, from the hip to the knee versus when you're standing. The angle is shorter, so it shortens. You develop a contracture. Now you stand up and you want to stretch and walk. The problem is the muscle's been trained to be shorter, so it's got to pull on something. Specifically, the muscle I'm talking about, the hip flexor, psoas, attaches to the L1 through L5 wings that are on the side, and then the other side, the largest bone in the body, the femur. Who's going to win a tug of war? The vertebrae or the femur? So what happens is it pulls the vertebrae forward and down, which creates pinching too. Joint degeneration, these compressive forces, they cause the joints themselves to degenerate. Arthritis kicks in faster because of compression. We shrink because of compression as we get older, and the ability of the body to imbibe, to absorb water, to allow ourselves to expand becomes more difficult. So everything's working against us. Second, chronic pain and stress. Chronic inflammation. When you have chronic inflammation, the body is in such close proximity, it affects everything else that's near it. So a lot of times you'll have glute pain, quadricep pain, ITB pain, anything because of what's going on. Of course, if you're having pain all the time, it's going to affect you mentally. You're going to be more prone to depression, frustration, irritability. A locked sacroiliac's impact on posture and spinal health. So the spine, when you look at it, can only be looked at two ways, basically from in front, right to left, and sideways, front and back. That's how we look at the spine. From in front, your spine should be a straight line. Very few people have an exact straight spine. Usually, if you take a look, some of you ladies will know this, your bra strap on one side will keep falling down. If you wear a blouse or a tank top, that may fall down. And the reason is because of the modification that the body went through. So it's slipping down because that's the way you're telling gravity to interact with your body. Compensatory. I've already spoken how the body adapts to everything that we do. So if you're having pain and you need to walk from point A to point B, you're not going to give up walking. You're going to figure out a way to do it. And your body's going to help you figure out a way to do it. And you're going to start utilizing muscles that were not intended to be used for that purpose, that you're recruiting in order to do what you're doing. And they're going to be prone to injury because you've never trained them to do what it is you're asking them to do. Risk of falls and injuries. That's a huge one. As you get up there in age, every time you fall, the chances of fracturing a hip, incredibly high. Incredibly high. So you want to be really careful with joints and issues and things that are happening. The osteoporosis connection. So because the sacroiliac is locked, and we just talked about other joints taking the brunt, as we age, we have issues like osteoporosis. The body doesn't handle stress the same way it did when we were younger, so you're prone to fractures. Systemic health implications, obviously, if you're in pain and not moving, your cardiovascular system takes a hit. You're not exercising. You're becoming sedentary. And then the second one is atrophy, too, if you're not moving. Muscles start to atrophy, affecting everything else. And then lastly, if you're in pain and your sleep is disrupted, sleep is probably one of the most important things we do on a daily basis. It's when the body repairs itself. So if you're not sleeping, how much repair are you getting? Exactly. All right. So now we get to the Bax-si. So how does the Bax-si work? So what I have discovered over the past year with the Bax-si, it's 100% effective with people who have lower back pain. Literally. Doesn't treat the lower back pain. What it does is, remember, it alleviates the pressure that causes lower back pain by opening up the sacroiliac. Let me see. How much time do I have left? Just because.
30 minutes. I was just giving you were.
All right, I'm sorry. All right, I'm going to wind down. I apologize. But I do want to steal one person. Ava, if you come for a second. There's so many things I didn't cover. It's obviously a hot topic with a lot of information. But what I do want to do is allow me to introduce Eva.
Hi.
Eva's a back pain sufferer. How long have you had back pain?
About 15 years, I don't know.
15 years. 15 years, and she sought treatment, a number of different things, and from time to time it keeps coming back. Now, Eva bought the Bax-si last time she was here, just wasn't sure about using it, and since they were in town, they decided to come, and I guess Alana told her I was going to be here, and I'm now going to show you exactly what the Bax-si does. So lie down.
Do you want to move it up there so we can see?
Oh, okay. Yeah, that's fine. Yeah, lay down face up. So the Bax-si comes with two heads. Thank you. You get one body, two heads. There's a blue head and a green head. The green is the soft head. The blue is the firm head. I usually recommend starting with the green, going to the blue, working your way up as you get used to it. Now, I'm not going to lie to you. Anyone who's been in physical therapy knows that what physical therapists do hurts. PT stands for physical torture. So inevitably, I would be remiss if I didn't cause some sort of discomfort during treatment.
Awesome.
All right, so the first thing I do is I look for the sacroiliac.
Change sides.
So if you remember where the African elephant ear meets the arrowhead. So I'm first going to use my hand. Okay, I'm right there. You're going to feel it burning.
Okay. Feel it already.
Stuart.
Now what I'm doing is I'm letting Ava's body slowly sink onto my fingers to allow myself to be able to grab the edge. And now my fingers are in and I'm gently pulling it open. Feel the pull?
Oh, yeah.
And you do it 2 to 3 minutes. That's it. Good. Keep breathing. How painful? You can be honest.
It hurts.
You can be honest.
It's not excruciating, but it definitely hurts a little.
So you can see the fingers are squashed down, and you can see the line of where I was able to grab the sacroiliac itself and pull it open. Now, on the other side, I'm going to use the Bax-si, just so even. So you lay down on the floor on a firm surface. And all you do is roll back onto it. I said I was a walker.
I mean, when he has to move.
There's 4 positions. This is position 1. It has the least amount of pressure on the head of the Bax-si. This is position 2. Feel the pressure? The objective is to get to position 4. This is position 3. 1, 2, and 3. Each time pushes the sacroiliac directly, as you figured it out. The objective is to get it to position 4, which is this position. And just relax. There you go, right there. Feel the pull?
It actually feels better like that than like that.
Holding it for 2 to 3 minutes. You do it every day. At the beginning, you may be sore the next day, so I recommend using an ice pack just to calm it down, but the objective is to use it every day and to basically keep the sacroiliac open and unlock the pressure on the spine. Okay. Come on up. When you first get up, do not stand up right away. When you're laying horizontally and you're in pain, you tend to hold your breath. You increase what's called your intrathoracic pressure. Then all of a sudden you sit up and all that blood rushes down to your feet. So you got to give it a chance to get up to your head. Feel good? All right, welcome. Do you feel anything different?
Right now, it feels okay. I'll let you know in about 3 hours. No.
Try touching your feet again.
Just straight.
Straight down. Try to go as far as you can. Any restriction? When you come back up? Any tightness?
Feels okay.
Perfect. Thank you.
Thank you.
Candice, back to you.
Thank you. So that's basically it. I'm done. For all intents and purposes, I appreciate it. Thank you. Maybe at a different day.
No, great job, great presentation. Let's do some Q&A if you don't mind.
That's what I wanted to
About 10 minutes of Q&A.
Before we completely end, let's just do a quick question and answer session. All right, so please feel free.
You have a question, Freddie? No. Just to take a letter. Oh, okay, thank you.
Oh, okay, thank you.
All right, thank you.
Hey, so you said the cartilage is going away, right? So how do the cartilage is going away,
Yes.
right? So how do you regenerate the cartilage and avoid to do that every day of your life?
How?
How do you avoid to do
Avoid?
that every day until the end of your life?
Oh, okay. So by the time so that's a very good question. By the time you have lower back pain, remember I said it's not an articulating joint, so there's not a lot. Chances are you've already degenerated that area, depending on your lifestyle. Of course, every one of us has a different lifestyle. If you're more active, doing more dangerous adrenaline type sports, chances are you're going to wear through it much faster. The thing with the Bax-si and what we've discovered is people who don't have lower back pain have used the Bax-si. I have young athletes. I have a young soccer player, 5'7". We did a test with 8-foot ceilings. And what I did was I had him do a standing vertical jump. And he could not reach that ceiling tile. No back pain, just couldn't reach it. We did the Bax-si treatment. Afterwards, he was able to jump through the ceiling tile. He gained 6 inches, which meant that the sacroiliac was locked. He didn't know because he didn't have pain, but it was affecting his ability in performance. I have a football player who brought his son in, who's playing right now at Iowa. And he did a standing long jump. We measured him before and after. When he first jumped, what was the difference, Robin? Was it 8 inches or 9? He jumped 7 inches further after using the Bax-si. He was able to stretch 4 or 5 inches further after we did a stretch box. So the key is this device was invented for lower back pain, but you don't have to have lower back pain to reap the rewards from the Bax-si. What we've discovered is that by alleviating the pressure, people feel lighter on their feet. It's the #1 thing that people say when they get up off the table with a treatment. I feel like I'm walking on a trampoline. I feel like I'm walking on clouds. It's the common statement when people get up off the table. Yes, they have soreness because the device is pushing in. But that kind of pain, soreness goes away within a day or two. The other pain is chronic.
Thank you. There's Brewster. And we have only 10 minutes for questions. So if you want to raise your hand.
I'll rush.
Well, A now, yes, sorry.
I just wondered, I couldn't really tell from your demonstration where that goes on the back, where when you're lying on that, where does it actually go?
So if you've seen pictures of people that have, there are 2 dimples. That dimple is known as the PSIS, the posterior superior iliac spine. That basically is the tip, the point of the African elephant ear. So that tells you where the SI is. So if you put your hands on your hips and you slide, you'll feel this ridge, this bump. Just to the inside, you will feel it taper off, drop off. That's the sacroiliac. So we've been told that another way to describe it is if you go to the top of your butt crack and just go 2 inches out.
That's how.
What? Sorry, Joe.
Have the hand grip part, okay, then you have the, so what faces what? Does that hand go below, is it facing
Oh,
downwards?
no, it faces out. So
That's what I'm
the
saying.
backs, so here.
Yeah, maybe you have somebody place it on your back so we can see, how about that?
So here's this, right there.
Oh, it's off center. Oh,
Excuse me, I'm not. No, it's fine.
there, your wife is gonna come and help.
So the top of your butt
We need
crack.
a model.
The top of your butt crack
No,
is
that's what I'm
right.
saying. No, let me show
No.
them actually on me. That's what I'm saying. Hold on.
His back.
Excuse me.
Okay, that's more than I would have done. So the top of the butt crack is here. See this middle section right here? This is your guide. So you see how it's the hands are here. You line that up with the top of your butt crack, this middle section. And it's literally only a couple of inches, maybe 2 inches from your butt crack, like when you go out. And you'll kind of feel it when you lay. It's lower than you think. A lot of people are putting it up here, but it's on your behind. It's like on your butt.
So it's actually off center though.
It is.
Off center.
It is.
But you don't do both sides, you just do the one
Both
side?
sides.
You
Oh.
do both sides.
Okay.
Always do both sides.
For about, in the beginning, you do it for about 2 to 3 minutes on each side as you get used to it. But like I've been using it since we started. And now I do it every day for maybe a minute, just to give myself that ability to get through whatever I'm gonna do. And honestly, when I don't use it every day, I feel my back tightening. So if you just do it, just like we use foam rollers or any other things all day, every day, just incorporate it into your daily recovery routine. And I promise you, you will feel better.
Great. Do you have a video online at all? To show
Everything.
that? To show that? Okay. That shows how to set it completely?
www.Bax-si, Baxsi.com.
All right, there you go.
If you go to the website, all the videos are right there.
Videos plus explanations to that.
And everything.
Awesome.
Everything is right there.
Thank you.
Is it replacing chiropractic adjustment?
So it's not replacing anything. The SI is very hard to perform a chiropractic adjustment to because it doesn't pop. So what chiropractors usually will do is have you lay in a prone position, which is on your stomach, and they'll try to push one side up and the other side down to get gapping. It's not replacing anything because there's nothing like this out there. There is nothing that works its way into the sacroiliac and actually pries it open.
Thank you. I want to remind everybody online, if you have questions or comments, please let us know. We want to hear from you. There is? Okay.
Check. Thank you. So this is from someone online. He says, does DDD in L1 through L5 contribute to lower back pain, and can Bax-si treat pain not from the sacroiliac lock?
Okay. So did he say DDD?
Yes.
Degenerative disc disease. So basically what degenerative disc disease is a technical term for arthritis, for wear and tear. It's a way for you to get a diagnosis without telling you exactly what's going on. I apologize for, letting the cat out of the bag, but that's what it is, because we as patients are always looking, why? If we don't get an answer, the doctor's not worth his weight in anything. We want people to tell us why. So that's where the problem is with DDD. Will the Bax-si cure it? No. But if you remember what I said earlier in the fact that if your SI is locked up and you may not even know, remember your muscles are creating force in the spine, a conflict of force, which causes your spinal muscles to tighten. What it will do is alleviate that force and reduce the pressure on the spine so you don't have the compressive forces that are degenerating your spine. And I hope that answers the question.
Thank you. We have Sarah here.
Thank you.
You're welcome.
Now I understand a lot of stuff about myself. I don't have any pain, and I'm doing a lot of athletics. And usually when I was younger, I could do the bridge very good, like really. And I decided to do something about it because for decades I didn't do anything about it. And I get from this to a lot of this by stretching here. My question is, if I will use that, it will make me more flexible.
So it's a difficult question to answer, and I'll tell you why. If your sacroiliac isn't locked up,
I don't think so.
you would be surprised. And the reason is because the sacroiliac itself doesn't have any muscles that go over it. It's all ligamentous. But it's got the strongest ligaments in the body going right over it, which is why it is so critical, why it has such an impact and such an effect on the spine and the rest of the body. To answer your question, try it. After we're done, I'll be more than happy to show you, and you tell me what you think.
All right.
The proof is in the pudding.
All right. We have time for one more. Anyone?
Perfect.
Let me say this. Yeah, thank you so much. So in essence, it can be good for maintenance then. You don't have to have the condition or tightness there.
Oh, absolutely.
Because most likely you're saying sacroiliac it's jammed up for most people anyway, you don't know it. So because it's good maintenance, it won't offset your spine in any way. I mean, from that level, there are situations people can use certain back tools and you have a good back, but then all of a sudden you've offset yourself and then you got pain. But that's not something in this case. Is that correct?
1,000%.
Okay, okay.
Our body was not intended for going through the abuse that we put it through on a daily basis. Now, what do I mean by that? Concrete's everywhere. We ride in higher cars, trucks, hopping in and out, carrying a lot of stuff. All these things jar the spine every time you put your foot down. We have stairs in the house. Once in a while, you'll slip and catch yourself. All these things can cause a sacroiliac to lock up, and you don't even know because you don't have pain.
Yeah, exactly. So you want to tell everybody how they can get this and maybe how much it can cost, or what you're looking for?
So that was one of the big things.
Yeah, thank you.
When I developed it, I wanted to keep the price point under $100. So that's what we basically did. You can buy this at www.Bax-si.com for $100 plus tax. That's it. That's basically, what's it, Robin? What's it equate to with tax? Right, if you're not in Arizona, that's right. The box has both. It comes with the bag, the device, and another head. I only put them both together. I only put it together so you could see them, knowing I was going to do a treatment. Which one did I want to use? I use at home the blue one.
That's a softer one.
This is the softer one. You'll see it bending. The blue one is firmer. Now, through regular use, you don't have to do it three minutes every time. Once you train your body, remember what I said, memory, you only have to do it for about 30 seconds aside. It does not take that long, but you have to train your body to get there.
All right, well, thank you so much.
Oh,
Great
you're
job,
welcome.
great presentation.
Thank you.